It's a disease that's more contagious than Ebola or influenza, but it can be prevented by a simple, readily available vaccine. And yet, in a number of countries, including some once declared measles-free, cases of the disease are on the rise.
UNICEF and its partners are supporting governments urgently to reach millions of children in countries around the globe. Measles is a highly contagious viral disease which remains an important cause of death among young children globally, despite the availability of safe, effective, and inexpensive vaccines.
Some health workers contend that the increase in cases of the disease now is a direct consequence of successful vaccination campaigns in the past.
As a result, we relaxed, and the general population began thinking that the vaccination was perhaps not necessary. So the uptake in vaccinations dropped, which means the number of the vaccinated population declined, and with that, we lost protection.
In a number of regions, some are opposed to vaccinations for personal, religious, or medical reasons. This the case in Oregon, in the US, described as an anti-vaccination hotspot. Last month, health officials declared a public emergency after at least 50 cases of measles were confirmed in January alone. And the situation is more critical in war zones like Yemen, where diseases like measles are made even worse by widespread malnutrition. Nearly 16,000 cases of the disease were reported last year. At least 260 children died. Yet despite the ongoing conflict there, more than 11 million children were vaccinated last month alone. This just the beginning in a new global fight against an old and deadly enemy. Mike Hanna, Al Jazeera, United Nations.